So, looking at, as you said earlier, this pandemic, we know, originated from China, and it's spread around the world. And as we read the news, and I happened to see the harm that it was causing in Europe and other countries, we thought it would be very wise to also put up something to help support the pandemic.
Hey, thank you very much for checking me out. This is Ekow Simpson. It's been a while that I posted a video because I was moving around. Like I told you on my previous videos, that I want to get you relevant videos that will help, project Africa to the world. So that is why today we are here in this. I know most of you are nurses, so and then doctors. You work at the health centers and facilities, so you would know exactly where I am. It looks like I'm sick, right? No, I'm not. I'm just chilling right here with my brother Ato. So I'll let him introduce himself, and then we will take it from there. My brother, welcome to my YouTube channel.
Oh, thank you.
Yeah, so can you introduce yourself to my viewers?
Hello viewers, my name is Ato Kwamena Nunoo. I'm the director and co-founder of Lula Foundation. We built and designed this unit that you see right now.
Alright, beautiful. So you would agree with me that since January, let's say December 2019, there's been this weird COVID-19 coronavirus and all that, and even now we still have cases of people dying. We still have cases of people recovering, which is also good. And then there's this, every country is trying to come out with a strategy. It says use hand sanitizer, wash your hand with soap and water, use nose masks and all that. We've been doing it all the time, and then we know that this pandemic one day it will go off. But in as much as we pray that it goes off, we have to prevent ourselves, and then also look at ways and means we can help others who have gotten it. So during my research on COVID-19 and the new inventions that are coming up, I chanced on this brother and this beautiful project that he has come up with. If you are not lucky or unfortunate to be infected with this coronavirus, which is killing a lot of people, you need or you have to be isolated. When we say isolated, it means that you need to be sent somewhere where you will not see your family like every day like we used to, or even those people who are taking care of you, they won't come to you each and every day. They will come when they think there's the need to. And talking about isolation, this is what is bringing us here today. My brother has this project, as you are seeing on your screen, an isolation unit. So let's have a one-on-one with him and then know how Africans, are inventing, during this period. So Ato, what came into mind, and then you designed this? So what do you call this project?
So actually, this project is called the Phront-Lyne unit.
Phront-Lyne unit. Okay.
Phront-Lyne unit. The name Phront-Lyne unit because this is a time that the world never expected to get this pandemic, and as we know the harm that it has caused around the globe. So to appreciate the frontline workers who are working tirelessly to sacrifice for you and I, putting all that they have on the line, we coined the name Phront-Lyne to show appreciation to our frontline workers all around the world. So that's the reason why we came out with the name the Phront-Lyne unit.
Okay, so the Phront-Lyne, the name, we understand. So what gave birth to the idea itself? Why did you decide to pull up this project?
So looking at, as you said earlier, this pandemic we know originated from China, and it's spread around the world. And as we read the news, and I happened to see the harm that it was causing in Europe and other countries. We thought it would be very wise to also put up something to help support the pandemic. We know in this pandemic a lot of people have come out with inventions in various countries to support and curb down the spread. So we also thought of putting up something to help our communities right here in Ghana and be able to support the existing facilities that are there to control and curb the virus and future ones that may present itself as well. So we thought of designing something that could be versatile. And as well as it's versatile, we designed something that could also be mobile. Looking at the terrain that we find ourselves, our communities and our both urban and our rural setting. Aside that, we also thought of designing something that would have all the basic infection preventive control measures. So we factored that in the design as well. So something that will be very efficient, affordable, and very adaptable, very versatile, that even after the pandemic, we can use it for a lot of things, and it will help improve our healthcare system.
Right. So you are looking at helping improve our healthcare system. I keep telling people that even in the Western world, where we think that their health system is like super 100%, they are still even having death cases more than us, right? Few weeks ago in our news outlet, I don't know if you also heard it, that about even in Cape Coast Teaching Hospital, we had about 15 to 25 frontline workers getting infected with the coronavirus. Why do you think such happened? Is it because they were getting closer to these people, that is why they were getting them? Then if yes, that will lead to your construction of this isolation unit.
So basically, the government has put up a lot of strategies in place to help curb down the virus spread itself. But we also wanted to support with the idea that most of our healthcare workers in our various community clinics and other hospitals that are not specialized infectious disease centers are also sometimes exposed, because what happens is if somebody falls sick, the first point of call is the nearby clinic or a community healthcare center before that person may be suspected or even possibly diagnosed and probably referred to a proper infectious disease center. At that point, we should be able to have a holding center for that patient to be held. In that case, protecting other patients and staff as well. So if somebody is sick, the person walks into any nearby healthcare facility, there should be some kind of isolation place for that patient, so that if doctors need to refer that patient to a specialized infectious disease center, at that point in time, that patient is being isolated from other patients and healthcare workers. And also in the design, later if we take a tour of the facility, we try to coin in a lot of inventions to prevent unnecessary contact between patients and healthcare professionals. So in that concept, we incorporated patient monitoring systems, so that from health nursing stations, nurses and doctors can monitor well-being of patients from their nursing station, and thereby saving the costs of PPEs. A lot of PPEs have to be worn periodically to come into the room, take vitals, go out. Meanwhile, whilst they are in just the nearby unit, which is also the nursing station, they will be able to monitor patients, get their readings. So they will need to wear PPEs and come in when it's necessary for them to offer physical assistance to the patients. So in that way, we're able to save the cost of PPEs, the amount of PPEs that has to be worn inside, and reduce the risk of patients to nurses or patients to healthcare professional contact. We thought of all those infection preventive control measures as well as being a highlight, so that a lot of our healthcare workers would not be infected, because they are the ones taking care of us. So if it happens that all of these ones tend to be infected, tend to be sick, at the end of the day, who takes care of who? And they're already sacrificing a lot. So this the little that we can also do to appreciate the work that they are doing for us.
Beautiful. I posted a video of another African brother who invented a hand washing machine, right? And now, is this your own invention? Did you sit down, you put ideas together and was like, okay, I think I can bring up some. Is this your own invention?
Yes, actually, this is my own invention. When the outbreak started, if I may recall, somewhere last year, early January, as the news explained that it was now being carried to Europe. At that time, Ghana has not even officially recorded a case yet, perhaps in Africa. Then the idea came that at that time, mostly in most European countries, they had makeshift canopy tents. They were being proactive to help curb down the pandemic spread. And I thought of over here too, I'm sure we can also do something, design something to also curb down the spread. So what are some of the available resources that we have here that we can use to design something which will tend to be more mobile, more cost effective, more efficient, and at the end of the day, save lives. That's the most important thing. So I happen to live in Cape Coast as well. So in our busy highway streets, you tend to see a lot of trucks because the Cape Coast city falls in between two major port hubs, the Tema Harbour and the Takoradi Harbour. So there's exchange of goods. So the trucks, you see these containers passing in and out. So the idea just came, why don't we just, these containers are available. They are available, and once for them to go waste, we can get very good food grade containers. Food grade because there are also containers that carry chemicals. This cyanide and other chemicals that are very harmful chemicals. But we have food grade containers that is being used to distribute food to countries, carry food. So those food grade containers are safe. So I thought of, why don't we get food grade containers, very affordable, very efficient, very versatile isolation units that can be deployed quickly. So in our design, this whole unit could be assembled within about 4 to 5 working days. Wow. If the containers is available.
I was going to ask him how long it will take for them to get this place done, and he has already mentioned it. Let's say 1 week. Let's say 1 week, right? Assuming we have all the necessary equipment, everything that we need.
Yes.
What is the measurement of, if you don't know a container, when you guys in the United States, in the UK, Brazil, wherever in the Western world or Europe, you want to send some stuff to Ghana or Africa, we put it in this long, very long container, right? If you've seen that one, that is what he was talking about. So how long is the container?
So this container is basically a 40-feet container, and this very one happens to be the high cube because we wanted to make use of a lot of space. So this is a standard 40-feet container high cube.
Okay, 40-feet container high cube.
Yes.
Okay, he's good with that, but So we're going to talk about what is in this system, right? In this unit. Okay, I'm going to mention that I can see a TV. Later, I'll let him explain why they have all these things here. So I've seen a TV, I've seen air conditioning here, I've seen some sockets here in case somebody want to, plug in the phone or something. I've seen there's a clock here. I've seen a camera. He has already explained, but maybe he will go ahead and here. And I've seen fire extinguisher here. Aside that, there's a bed, there's a cabinet, And all these came with a cost, I am sure. So he would also come up with the budget, the estimate of everything that he has done here. And then when you go in there, there's a toilet facility. So take us through what is here. If somebody should enter now, what will they see and why do you have them here?
So basically, as you see earlier in the video, probably we've mentioned containers. So you might be a bit surprised. The inside doesn't actually look like a container. You think it's an upscale medical facility. So basically, the floor space is about 30 square meters. This very unit, this very model, has 2 rooms, 2 patient rooms. So this is the first patient room that you are seeing right now. So the patient room can take 2 beds each. So the entire unit takes 4 beds, and it has 2 bathrooms and washrooms as well, separately. So every room has its own accessible standard bathroom. The other room has its own standard bathroom as well. So as part of the infection preventive control measures, we try to limit the lot of shared facilities between patients.
Okay.
Because if patients are being isolated, whether it's a confirmed case or a suspected case, they don't have to be mixing and sharing a lot of things. That's why we decided to bring in a standard bathroom to each room, so that aside privacy issues, most importantly to prevent the spread of infections, they don't share a lot of facilities other than them being held at a place that all those patients are sharing one toilet and facility. The risk of infections being spread, cross-contamination is very high. So we consider that into the engineering as well. So basically, it has 4 beds, 2 standard bathrooms. That makes up the ground space of the unit.
Okay.
Then we come to the insulation of the unit. So the unit is well insulated. The entire unit, in our part of the world that we find ourselves, because of our weather, most of the times it's very hot.
And you are sleeping in a container.
Yes.
Made of metal.
Yes. So it sounds like this is a box can, a can that it's in the hot sun, and even if you put a tin or any can outside in the heat during the day, you see it's very hot. But the thing is, there is engineering to make it cooler. And that secret lies in the insulation. So the entire unit is insulated all around, which makes it very cool. And after the insulation, that comes the easy clean surfaces, the walls that we see here. So all these walls are coated with the material that enables it to be washed, because it's an infectious disease holding area. Cleaning is also very important. The walls in the room should be cleaned, sprayed without damaging the walls itself or the materials of the wall. So we consider that into the engineering as well. So the whole place can be cleaned. Then it comes to the awning window. We chose the awning window because, as I mentioned earlier, to cool the place, we need a lot of fresh air. And the sliding window, in this case, as we wanted to make good use of space, we realized that we are going to just have 50% of airflow into the room. And that's why we chose the awning window, so that even if it happens that patients are in the room and the awning window is open, then there are some kind of showers. Because it's an awning window and the window is not even closed, the patients or the nurses don't even close, the rain or the showers don't enter the room. And yes, though you get maximum airflow. So that's why we chose those windows as well. Then we come to the floor. So this is a non-slip floor. A lot of engineering had already gone to the bedside. So what we see here, it's porcelain tiles, which is non-slip. we consider that to the flooring as well. Once there will be a lot of cleaning done here, and we chose this floor because it's very durable and easy to clean in our climate. So this sums up the technical details of the entire unit before we come to other fixtures in the room. So with the fixtures, what we have now, this current unit, as you said, has the television. It has an air conditioner. It has a camera for patient monitoring, and we are yet to install the oxygen equipment in here as well as the patient monitors on the bed heads as well. So that's and we didn't forget safety. So we have a fire extinguisher here. The unit itself, the material that we used in here, both the insulation and the wall materials are all fire resistant. So in case of leaving fire, this unit or all these things can't easily catch fire. We try to also coin in the idea that once it's an infectious disease center and an isolation center, that means the patients have to be isolated, kept at a place alone. And imagine even the small experiences we felt personally whilst we were in lockdown, whilst we were at home. Some of us felt that it was very boring. It wasn't something that we were really used to. Just for us to stay indoors for a week, 3 days without stepping out. So even if it happens that the person is very sick and not able to move out to catch some fresh,
no family
coming, or everything has to be done through the internet, on the phone, and all that. We thought about incorporating some kind of art therapy into the unit. So that's why we have a painting here. And we have another painting here. This one is a painting of Nzulezu village here in Ghana. So that once patients are here, the environment around, the things they see will help them reflect on natural sceneries and give them fresh memories, not to really dwell into their present condition. So we try to incorporate the art therapy in here as well. As you see the kente pattern curtains that we chose, that promotes the African culture. So aside the hospital bed that you see here, you get to realize that the place doesn't really appear as a hospital. It's just like being in your own house, the comfort of your own house, or living in probably a hotel or a rented apartment. So we try to coin all that into the design of the unit.
Beautiful. So I know you are enjoying watching and seeing everything you're seeing right now from an African brother who has invented this unit, Phront-Lyne unit. That is the name for this unit. Somebody would like to know, maybe sponsor or donate, because this is the first one, the specimen, the first one you've done. So if we get the funds, you would like to do more and also maybe distribute it to some communities so that you can help keep this thing. How much went into doing all this project? How much in estimate do you think will go or goes into establishing this?
So probably the whole concept is actually a bigger one, but as I said, with this very unit that we see right now, there are oxygen equipment that is yet to be installed in here. The engineering concept that we developed is such that if the unit is one that is going to be deployed to an urban center where there's a pre-existing health facility that happens to have an oxygen plant, all the oxygen works are buried inside the unit, so that the oxygen connections have to just be connected to the existing facilities plant, so that the supply comes. But whereas that the unit itself will be deployed into a rural setting, then it's not really necessary, whilst there's no plant there, apply the oxygen. So with that, the oxygen bottles are in place, the tanks are inside that will fix into the unit in that regard. Then comes the patient monitors. As I mentioned earlier, the entire unit takes 4 patients standard. It takes 4 patients, so 4 beds. So we are looking at installing 4 patients monitors in here. Then we know with this pandemic, this very COVID-19 pandemic, sometimes as scientists or the professionals may say, alters a bit its behavior. And one of the factors is that it affects our respiratory system. So sometimes the patient has to be supported mechanically to breathe. So it brings up the idea to get a ventilator on board. And it happens that ventilators are also very expensive in our part of the world. So we made a design in such a way that at least we have one basic ventilator in each unit. So out of the 4 beds, we have one ventilator in each unit, so that it might happen that not all the patients in here might actually need a ventilator, but if we happen to just have one in the unit, then the patients that might need to use the ventilator will have access to that as well. And as I mentioned earlier, that the concept is a very broad one. We made provision to make good use of the roof. Once it's a mobile unit, it contains about 30 square meters. There's a lot of space up there. So we also made provision to install solar panels up there to help with the electrical consumption. So with that electrical, when later we go outside, you see that we also made provision to use the hydroelectric power, as well as provision to also use a generator or a backup alternate power as well. So we try to put all that into the unit, as well as the cameras for patient monitoring and all that. But this is just the first prototype to actually prove the concept. So it's work in progress.
So you cannot come up with it.
Yes. So as I talk to you now, we've invested a lot into it right now, but it's work in progress. We are yet to fix the other installations in here. So I'm sure in our subsequent video by that time, all those things will have been done.
Alright, so he's giving an explanation as to why we cannot come up with an estimate now, because yes, things need to come in. You know, we need to consider a lot of things, especially where you have to send it to urban places or rural communities. It all comes with a different cost and all that. So I will leave his email under the description. You can send him a direct email and then have a conversation with him as to the best way you also think you can suggest to this project. So alright, so we are almost at the end of this interview, and I promise you I'll bring you more from this section as to what goes in and all that. But my last question to him is that a lot of people are watching. In your mind, what do you suggest that the government of Ghana, or maybe the government of Kenya or Tanzania, I mean, because a lot of people might get to watch this, what do you think these leaders should do? Aside that, what do you think any individual should do to support what you are doing right now?
With that one, I'm sure a lot of governments have put in a lot of strategies to help slow the spread of this pandemic and fight it as well. And our future plan is to get this unit to all communities around Ghana and beyond. So you can also support us to get one unit in your community. That is the future of this unit or of this initiative. We want to get the units to every community. So every community would have an isolation system at its health facility, at a CHIPS compound, or at your nearest point of call, your any community healthcare provider. So the dream is to be able to have these units across board. And to emphasize, this unit doesn't just end with COVID-19, this pandemic. We need to plan for other future pandemics that come as well. And aside the COVID-19 pandemic, it could also be adapted to serve so many other purposes. This can serve as a community lab, a pharmacy, a consulting room, and isolation units in our various schools. All these places can make good use of this unit. So it doesn't just end with COVID-19. It's just like a residence that can be adapted to serve so many other purposes. So in that way, if a future pandemic is to erupt, that we all pray that it doesn't happen, then it happens that we are prepared to deal with it, to support whatever facilities that are already existing. So to this end, I would like to appeal to all the viewers, all of you that want to support this project. You are welcome as well. You can visit our website www.nulafoundation.org, or you can send us an email at info@nulafoundation.org to know how to support the project. So you can help to get one of these units to your nearby community, to a brother, a friend, a mother, or a relative. Get one in your community. Let's help fight the spread of this COVID-19 pandemic. And also don't forget to wash our hands and wear our nose mask whenever we go in public.
Alright, so the appeal is clear. I know you are making plans to come to the motherland, whether Nigeria, Togo, anywhere. Just have a conversation with the brother. Like I said, I'll have his email and then website in the description. We are appealing that you get one of this for that community where you want to live. Let's help save Africa and the world. Thank you very much for checking us out. I'm on Patreon. Go on Patreon and subscribe to my Patreon account so that you can support me, support brothers like this, bring out whatever inventions they are doing to the world. Thank you very much for checking us out. Put up a comment, share this video, and then like it. Right.